PCOS, polycystic ovarian syndrome, one of the most common hormonal endocrine health problem of a young women. Out of 10 women, nearly 4 to 6 women are struggling with PCOS in today's time. And everyone wants to get treated. But when we talk about the treatment, you must understand that what type of PCOS you have. If you know the type of the PCOS and then if you treat it accordingly, you have a higher chances of getting out of this problem. And what are those types? That's what we are going to learn in today's topic. Namaste. My name is Dr. Tanvi Mayur Patel. I am an endocrinologist, hormone specialist doctor from Mumbai, India. Now before we continue, one information, if you want to watch this video in Hindi language, then on the I button and below in the description box there is a link. If you click on that link, you will find this video in Hindi language. अगर आपको आज का इस वीडियो हिंदी भाषा में देखना है तो ऊपर आई बटन पे और नीचे डिस्क्रिप्शन बॉक्स में एक लिंक है. अगर आप उस लिंक पे क्लिक करेंगे तो इस वीडियो को आप हिंदी भाषा में पाएंगे. So let's continue our today's topic, that's on a polycystic ovarian syndrome. Most common endocrine health problem. What are the types of PCOS? That's what we are going to learn. First and foremost, you must understand that PCOS is not a disease. Yes, you heard it right, it's not a disease. It's rather a condition wherein lot of other parameters of your body are disturbed. And because of the various disturbance in parameters, your body is showing the symptoms. Symptoms of excess or a higher level of the male hormone, that's an androgen, and symptoms of a disturbed ovulation, which in turn leads into the monthly regular cycle abnormalities. Okay, so basically it's not a disease in itself, it's actually a syndrome of various conditions. It is possible that one person can have a major component of a one functional type of PCOS and other types can also be existing. However, the 4 major functional type of PCOS is as per our clinical experience and what kind of patient gets treated better with a one kind of a treatment. So let's talk about the first type of PCOS, and that is called as a insulin resistant PCOS, or we also call it as a metabolic PCOS. As the name suggests, the insulin resistance means there is an insulin resistance. By the way, this category of the PCOS is one of the most common. Nearly 70% of the PCOS belongs to this category. What is insulin? See, insulin is a hormone. It comes from a gland, that is a pancreas, which is located in your abdomen. The main role of the insulin hormone is to balance your blood sugar. Whatever food you eat, that food has a energy in the form of a glucose. Insulin ensures that this glucose gets actually converted into an energy, and this energy is utilized by the various parts of your body, including your liver and muscles. When you have insulin resistance, what happens? Either the insulin hormone which is there in your body is not functioning properly, and this is called as insulin resistance. Insulin resistance does not happen overnight. Yes, it is a slow process. So you might have a problem today, but the problem might have started a few years to months ago. So when you have insulin resistance, your body will try to fight it. And they will try to fight it by producing more and more insulin hormone, thinking that the insulin is not working properly. And this leads into high level of insulin hormone in your blood. And when you have a high insulin in your blood, it stimulates your ovaries to make more and more androgenic hormone like a testosterone. At the same time, this high level of insulin also disturbs the ovulation process, and that's the reason why your monthly regular cycles becomes irregular. Okay, this is how it works. Now you must be wondering suddenly how I became insulin resistant. Now see, there are many reasons. Your lifestyle, your eating habits, your physical activity habits, whether you are living a sedentary life or not, how stressed you are, how is your sleep, whether do you do smoking, alcohol, it all depends. Whether there is environmental toxins, all of this can also impact on your insulin resistance and they can develop. So if you have overweight or obesity, you will have insulin resistance. How will you know that you have insulin resistance? Of course, we do blood test, but before blood test, your body itself is going to tell you that you are resistant. How? So first of all, you might have an excess of body weight. You might have a skin tags around your neck. You might have a dark patchy skin, what we call it as a Acanthosis Nigricans. Your waist circumferences will be more than 35. Then if you check your blood pressure can be high, your uric acid can be high, your cholesterols can be high. So these all indicate insulin resistance. And for insulin resistance, we do a blood test. What testing we do? We'll do a testing to check your insulin level. We will check your level of a sugar. We will do 3-month average blood sugar test, because when you have high insulin, it leads you into condition called as a pre-diabetes. Yes, a borderline diabetes. So we want to know that also. We also want to know what is your HOMA-IR index. So these can indicate whether you have insulin resistance or not. We will do your blood lipid profile. Your triglycerides level can be high. So all of these are insulin resistance marker. And when you have this marker, we can say that you have an insulin resistant type of PCOS. And when you know your type, how do we treat it? Treatment is very easy. You have to live a holistic life. However, the treatment also will not give you results overnight. Patience is required. So what you have to do? First of all, you have to check on your body weight. If you are overweight or obese, you are encouraged to lose weight. Secondly, you need to do regular physical activity or exercise. You need to eat on time and a balanced food, low glycemic index food with a good quality of a fat and a protein. You have to let go of all your junk food and habits like smoking and alcohol consumption. Once you tackle this, you also need to pay attention on your stress and your sleeping habits. Yes, sleeping also plays an important role in insulin resistance. So you need to work upon all of these lifestyle factors. Besides that, certain supplements will also help you. Supplements like myoinositol will help you. There are medications which we use to reduce insulin resistance. Metformin is one, then berberine is one. So these are the certain medications which can also help you in PCOS. So this is a nutshell. First category, insulin resistance or metabolic PCOS. Okay. Now we move to the second category of the PCOS, and that category is the inflammatory PCOS. Yes, inflammatory PCOS, we also know it by the term called as a hidden PCOS. Now you must be wondering why hidden? Because we need to know what is a causative factor which is causing the inflammation. And many of the times we may not be able to trace that inflammatory factor. It can be hidden. That's why we call it as a hidden PCOS. So how inflammation causes the PCOS? See, this inflammation is a body's tissue's response to any kind of a trigger. And when your body is continuously triggered by an inflammatory component, your body will produce more and more inflammatory markers. And this continuous long-term chronic inflammation will trigger ovaries to make more and more androgenic hormone. So hormones like testosterone, DHEA, androstenedione can be increased. This chronic inflammation also suppresses the ovulation. It also suppresses how the receptor functions and a hormone functions, and that's the reason why chronic inflammation is one of the again very common component of PCOS. Many times it's possible that a person can have a inflammatory PCOS along with the insulin resistant PCOS. Now where is this inflammation coming from? Now this inflammation can come from anywhere. It comes from your environmental toxins. It can come even from your food. Yes, the food, if you have any kind of a food sensitivities, especially of the gluten or a dairy, and when you have such protein sensitivities, your body will continuously be in a chronic inflammation. Similarly, if you are leading a very stressful life, again it can trigger the inflammation. So inflammation is also a very common component of the causing this PCOS. How will you know that you have a inflammatory PCOS? Now it depends on your body symptoms. So we have seen wherein a patient have a different kind of a symptoms. They have a fatigue, they have tiredness, they get a frequent headaches like a migraine headache. They might have some digestive issues. They might have some irritable bowel syndrome. They might have a skin conditions where they have a lot of itching. They're having frequent allergy on your skin. They're getting urticaria or hives. So this can be present. Many people also complain of a joint pain. So if you have all of these, it can indicate that you have a chronic inflammation inside your body. And when we do a blood testing, there are certain testing which we do, we find that your inflammatory markers are high. Inflammatory markers like high level of the ESR, high level of the C-reactive protein, high level of the lipoprotein A, high sensitivity C-reactive protein, HSCRP, all of this can be high. You might have a disturbance in your complete blood count. Your eosinophil can be elevated. So these are the various ways which we can find that your inflammation is there. And if you have an inflammation, then you need to work upon your inflammation. So how do we do that? So first of all, you need to cut down on the food which is highly inflammatory. And most of the time it is a dairy product, soya products and a wheat products which are very inflammatory. Similarly, all kind of a junk and a processed food, they are also inflammatory in nature. If you have any thyroid problem, if you have a high level of the antibodies, again you need to work upon that. You need to reduce on your stress. For that you have to do meditation, yoga, pranayam, which makes you calm down and reduces your suppresses your inflammation. Any allergies, any sensitivities, you need to work upon that. As I told you earlier, that sometimes we don't know what is causing the inflammation, and that's the reason why it is also called as a hidden PCOS. Some herbs like curcumin, ginger, ashwagandha, they help in fighting this chronic long-term inflammation. So if you have inflammatory PCOS, get yourself tested and get treated accordingly. Now we move to the third category of the PCOS, that's a adrenal or a reproductive PCOS. Among all the categories of PCOS, 10% of the women have PCOS of this variety. Now first of all, you must know what is adrenal. See, adrenal is a gland which is located on top of your kidney. It also makes hormone. Okay, nearly 100% of the androgen hormone which is present in the body, 60% of those androgenic comes from your ovary and 40% comes from the adrenal gland. This adrenal gland also makes androgenic hormone. Adrenal PCOS has a very strong connection with the family history. So if in your family, your mother, your sister or any family in your, any women in your family have a PCOS, you might have this category. In fact, we consider adrenal PCOS as one such variant of late onset congenital adrenal hyperplasia, which is also a type of a endocrine problem. So adrenal PCOS has a genetic component. There are certain epigenetic changes which happens in the androgen and adrenal, and that's the reason why this category develops. Adrenal PCOS behaves very differently compared to the inflammatory and insulin resistant PCOS which we saw earlier. In fact, it is found that if we try to increase certain changes, or if we incorporate certain changes, adrenal PCOS can get triggered. Changes like if you suddenly cut down on your weight, or sometimes if you are doing lot of fasting, or you cut down on your food, you do strenuous exercise, adrenal PCOS can rather get triggered. And that's the reason why it's very important for us to know that what type of PCOS you have. One clothes does not fit to all. Similarly, one treatment does not fit to all, and that applies very truly to the adrenal PCOS. How will you know if you have adrenal PCOS? This you will come to know only by doing a blood test. See, when you do a blood test, your doctor is going to ask you to do a testing for all the androgen. And when we talk about the androgens like testosterone, androstenedione, DHEA, DHEAS, they all are included. Hormones like DHEAS is coming only and only from adrenal gland, and this is the marker for us to decide whether you have adrenal PCOS or some other variant. And nearly 80% of the DHEA also comes from your adrenal gland. So if your DHEA and DHEAS levels are high, and if your other androgen like testosterone is normal, it indicates that you have a adrenal PCOS. Of course, it is possible that a person can have both the component of the PCOS at the same time, and that time the treatment can get little tricky. Okay, how will we address the adrenal PCOS? So first of all, you need to cut down on your stress. Yes, stress triggers the adrenal gland. So you have to calm down. You have to do meditation, yoga, pranayam. Very important. Sleep is very, very essential. Okay. Besides these two, you can incorporate a lot of adaptogens in your routine life. Adaptogens like ashwagandha will help, licorice will help, vitamins like vitamin B5, that's pantothenic acid, zinc, all of them will help you in managing your adrenal PCOS. Alright, that's the third category. Moving to the fourth category of the PCOS, and that we call it as a post-pill PCOS. Yeah, post-pill. Pill means medicine. Which pill? So these we talk about the birth control pills or oral contraceptive pills which women might have taken. Birth control pills which is known by a lot of brand names, and if those component contains a drospiron or cyproterone, so these kind of the hormonal pills, when you consume that, what happens? When you consume that, it is going to work upon your ovulation and you will not get pregnant. But what happens after stopping that pill? So after stopping the pill, there can be a short-term temporary rise of the androgen, and this short-term rise of the androgen gives you the PCOS. See, one of the diagnostic criteria of PCOS is a high level of androgen, and since you have that, we call that you have a PCOS. So how will you know? So you need to ask yourself, is my PCOS developed after starting this oral contraceptive pill? If your answer is yes, if your androgen levels are high, if your insulin levels are good, you don't have insulin resistance, if all your inflammatory markers are good, your DHEAS is fine, that means it might be possible that you have a post-pill PCOS. And what to do in this case? Nothing. Just wait, observe, do a good, better lifestyle, and that should solve your problem. Alright. So we saw today the 4 categories of PCOS, and which is very important for you to manage your PCOS correctly. I hope after watching this video you got some good useful information. If you have any of your questions, write below in the comment box. I'll try to answer them. And I have a quiz for you. Do you know what category of PCOS you have? If yes, answer that in the comment box. It will help others also to learn more about it. Alright, we will meet again with some interesting topic. Till then, take care of yourself. Namaste.